Hello everyone, I am Dr. Kaustubh Shende. I am a plastic surgeon in Sancheti Hospital, Pune. Today we are going to see the technique for dressing in the ward or the OPD, and today we will learn it step by step. So to open the dressing, first we will have to open the dressing with unsterile gloves. To open the dressing, make sure that you are not cutting the deep layer of the dressing so that you will not hurt the patient while opening the dressing. So now here we can see there is a big wound over the anterior aspect of the leg with lot of slough and pus discharge, and there is exposed tissue with the blood stains. So now to start a sterile dressing, we will take 2 scoops of the sterilium on the hand and spread it evenly on both the hands, taking the steps as Suiman, Sulta, Ulta, Muthi, Angutha and nails. Each step has to be done for both the hands 5 times each. Once this is done, we will take the sterile gloves and wear the sterile gloves in sterile way. Place the gloves on a clear flat surface. This is right side glove. Hold the inner aspect of the gloves with the left hand and insert your hand inside so that you are not touching any sterile part from the left hand. Once this is done, to hold the left hand glove, insert your right sterile part inside the outer aspect of the glove and then put in your left hand so that both the hands are sterile. So for us dressing of the lower limb, we need lot of things which we have arranged in a kit. So this is the kit which comes as a sterile packet. So now we have opened the dressing. We will first clean the wound with a saline. First of all, we will clean the periphery of the wound with clean circular strokes so that the residual dirt on the periphery of the leg will be cleaned properly. Once this is done, we will clean the wound and wash off the slough or the serous discharge from center to the periphery. Now we will take betadine. Make sure the assistant is far away and not touching your gauze pieces or your hand. Take adequate amount of betadine and again the same process, clean it from the surrounding. And not just the dirty part. Once this is done, clean the wound with betadine. If it's a very painful wound, you can just dab the wound with the betadine so that patient will not have pain while cleaning the wound. If you feel the need to debride the wound, you can take the forceps and scissors and cut off the minor dead tissue without touching on the healthy part of the wound so that this part of the debridement will be mechanical but absolutely pain-free for the patient. If you reach on the normal healthy tissue, patient will have pain while doing the debridement. Once this is done, we will take betadine soaked gauze, soak it properly, and once they are fully soaked in all the layers, spread the gauze on the wound so that whole of the wound is properly covered with the betadine soaked gauze. What material to be used has to be decided depending on the type of the wound which is present. Once the wound is covered with the betadine, we will cover the wound with the Gamgee roll, and this will be decided upon amount of the pus discharge or the serous discharge from the wound. How to tie a bandage? So start with the bandage on one side hold it on one side and make it slightly tight. The leg has a uneven circumference, so that is why when we are doing the dressings, the bandage becomes tight on one side and loose on the other side. To avoid these loose areas, you have to hold the bandage, pinch it and make it tight, and then cover it with the next roll of the bandage. At the end of dressing, the dressing should look neat, tidy and adequately firm. It should not be too loose or it should not be too tight, and patient should be happy at the end of the dressing.